Also falling within a CCMA scope of practice is the ability to collect and process stool specimens. Now, collecting and processing stool specimens is going to come with its own set of patient instructions because this is also a test that we can send home with the patients to complete at their earliest convenience. Why we would collect and process stool specimens is this could be a screening for what's called colorectal cancer. The test is a fecal occult blood test, and it's a test that is looking for hidden blood. So this isn't blood that we're going to visually see in the stool, but it is blood that the test can identify that is hidden within the stool. If there is blood that is found within the stool, it may indicate colorectal cancer, could possibly be hemorrhoids as well as gastric ulcers. However, broccoli and beets, there are drugs like aspirin and ibuprofen that may cause a false positive test. So these would definitely be qualifying questions that we would ask our patient prior to collecting and processing the sample. So in performing the fecal occult blood test, you're using a hemoccult test. And the hemoccult test is a common brand testing kit. It comes packaged just like you see here in the slide, and it's one box that has multiple slides inside for testing. With each test, you would only need one card here. Patient instructions for this, because our patients can do these tests at home, and if they're doing it in the office, it will come with its own particular instructions. So patient instructions would be that the patient would need to sit on the toilet as if they were going to have a bowel movement, and they're going to want to use a clean, dry container to be able to collect the stool specimen. Once they collect that stool specimen, they're going to make sure that it doesn't have any contamination with urine. We just want stool by itself. Now, with that stool, we're going to take these cards. This is a two-sided card here, and we'll be able to take what's called a really thin smear. So using the spatula here and opening this card, there will be two squares on the card. We're going to apply two very thin smears to the card in each of those boxes. It also comes with a test solution. So once that smear is placed on the card on one side, then we flip the card over on the other side, apply the solution, and then it will give you is either a color telling you that it's positive or negative, or it will actually read a plus or a negative for a positive or negative reading. Now, with this test, testing is recommended every year for individuals over the age of 50 as a screening for colorectal cancer. Those patient instructions, again, making sure that the stool specimen is not contaminated by water from the toilet or also contaminated by urine. And there may be some dietary restrictions that would apply, and that would be given to the patient by the provider. Also, in collecting and processing stool specimens, there may be a need to do what's called an ova and parasite specimen collection. The ova and parasite specimen collection comes with its share of instructions as well. Along with those instructions, there are specific containers that are used, and notice they come in different colors here. You're going to give the container to the patient along with the necessary instructions, and they can follow through using the very similar instructions in the fecal occult blood test and being able to obtain their specimen. I should also point out that ova and parasite specimen testing is used to examine for the presence of parasites and their eggs within the stool.